Some studies show that attrition rate for those participating in physical therapy, those who just stop doing it, is as much as 20 to 30%. How can that be? It is for our own good that we need to stay on track. Part of the answer simply involves the players involved in the story. For example, in the world of healthcare, we typically have a doctor, a nurse, and a patient. The doctor is a trained professional with education, knowledge, and lots of experience in their field. They assess the situation and give orders. Most often, they are entered into some automated or computerized tracking system. The nurse is also a trained professional, and they too have education, knowledge, and lots of experience in their field, and they execute the orders given by the doctor, and they follow up by using the same automated system. The patient is, the patient. They are typically not professionally trained, and they have little to no experience in this field, and they are given as few instructions or active assignments as possible. Now, let's move to the world of physical therapy. We take one of those three players out of the equation. The physical therapist is now the professional who has the education and experience and who provides the orders on what treatment or exercises would be best for the patient. But the only person left to give them to is the patient themselves. And with no advanced education in this field and no real experience, the patient is left with the only motivation that following this order will be in their best interest. And man has not always done things motivated by their own best interest. So that is one reason that we see compliance so low and attrition so high. But what about the method and process by which we deliver this valuable healing message? We often rely on audible and written one-way communication. According to a university study, we humans retain about 10% of what we read, 20% of what we hear, 30% of what we see, 50% of what we see and hear, 70% of what we discuss with others, and 80% of what we experience. So if we are relying on those first two elements, we can do the math. If we say or write 5 things to be done, as long as the patient does not lose that bit of paper, we have had to surrender to the hope that 1 out of those 5 will be done as prescribed. With that in mind, PT Pal was created as a mobile device app that is easy to use and easy to follow. As a physical therapist, you can make your assignments with the touch of a button, and your patient is gently reminded, encouraged, and tracked throughout their therapy. You stay connected between visits, and that very fact leads to greater compliance and less attrition, while offering you the opportunity for interim billing and greater health and success for your valued patients. Now, going back to that memory chart, PT Pal elevates your patient's chances of complying simply by taking them from hearing and reading all the way to experiencing the orders you have given in a new and meaningful way. PT Pal becomes an enhancement to your practice that allows greater insight into progress and recovery than ever before. It puts an easy-to-use and easy-to-follow tool in the hands of patients, and it replaces hard-to-follow and easy-to-lose bits of paper. Your patients now have less to remember and more to accomplish. To learn how this might work for you, write us an email or look us up on the web. PT Pal, physical therapy delivered like never before.